Hey everyone, my name is Liz Rektoric, and this is my evidence-based practice in nursing research poster. I did my project on congestive heart failure, which entailed making a checklist to use during mandatory education, and then seeing if this checklist reduces readmission rates. Congestive heart failure is the leading cause of hospitalization among adults over the age of 65 in the U.S. Despite advancements in medical therapy, admission rates following heart failure hospitalization remain high, with about 50% of patients readmitted to the hospital within 6 months of discharge. The readmission rates right now at Mercy Hospital of Buffalo for heart failure patients within 30 days of discharge is 30%. By using the checklist, I want to see this percentage drop by 15% within 1 month. At my facility, it is estimated that hundreds of thousands of dollars are spent annually to care for heart failure readmissions. By using a checklist, I hypothesize that it will ensure education is complete, thus improving the quality of care and decreasing readmission rates. Dezay and Stevenson, 2012, state comprehensive discharge planning, including patient and caregiver education, guidance regarding sodium and fluid restriction, collaboration with visiting nurses, and planned follow-up may reduce early readmission rates by as much as 25%. My clinical question, which is in the PICO format, is as follows. In congestive heart failure patients, does 60 minutes of one-on-one nurse-to-patient education with use of the SMART checklist, in comparison to under 60 minutes of education with no checklist, decrease readmission rates from 30% to 15% within 1 month? The use of the SMART checklist, which was developed, is as follows. The S stands for signs and symptoms. The M stands for medications. The first A starts for activity. The second A stands for appointments and follow-up. The R is recording weight daily and keeping a weight log. And T is tailoring the diet, which is sodium and salt restrictions and fluid restrictions. Research process. Evidence-based literature was found to support the clinical question using the following databases: CINAHL and Medline. Keywords that were used to search these databases were congestive heart failure, hospital readmissions, readmission rates, education, and checklist. After examining all the evidence, 5 articles were chosen that best supported the clinical question. The 5 articles were in level 1 through 3 of the hierarchy of evidence table. The table to the right shows a search history which includes inclusion and exclusion criteria and the number of citations retrieved and used. Data extraction. A table of evidence was used to organize extracted data from the articles which best supported the practice problem and clinical question recommendations. What does the evidence tell you? The evidence gathered suggests preventing heart failure readmissions is a complex task with many factors. The RCT by Basur et al. 2013 was found to be the most useful in that my practice changes include the use of a discharge education checklist to ensure comprehensive heart failure teaching of patients, with the goal of reducing readmission rates. The evidence shows a strong correlation between education and decreasing readmission rates. As patients are more aware and informed, the better chance that they are to be compliant with their medications, monitor for signs and symptoms of heart failure, adhere to a low-salt diet, and restrict their fluids as prescribed. The pre-discharge use of a simple and inexpensive heart failure checklist as part of a quality improvement initiative leads to a higher proportion of patients taking evidence-based and up-titrated therapies and decreased readmission rates due to heart failure. What direction does the evidence show to answer the clinical question? The evidence points in the direction of a checklist being useful in the discharge education and planning process for heart failure patients. It is shown to be beneficial and decrease readmission rates when used during nurse-to-patient education. Describing IRB involvement. Basor et al. 2013 supported using a checklist for practice change with consent from the Institutional Review Board, stating approval was obtained from the Institutional Review Board and the Cardiovascular Quality Integration Board. The study received approval and was then registered. For the study of preventing hospital readmissions for heart failure patients, IRB is needed as the study includes human lives and recommendations which would impact human beings. Heart failure is a prominent disease process and its exacerbations can be deadly if care is not sought. So recommendations for care and treatment must be approved by an IRB. Methods of implementation. The use of a SMART checklist during discharge teaching. Checklists will be added to heart failure folders. Ensure patient understanding through a teach-back method. In-services and net learnings for nurses to complete so they are informed of the new method. Checklists and recommendations will be posted at all nursing stations. And staff will have to check the box on the checklist to ensure its proper use. So when evaluating data, we have something to compare. Methods for evaluating change. Evaluate the readmission rates and data in 1 month starting January 2017 and determine if readmissions were decreased. Goal is to decrease readmissions from the current 30% within 30 days of discharge to 15%. To do this, we will gather data from the EMR and admission records. Methods for sustaining practice. Continued workplace integration of new methods, continue staff and services on progression of practice change, and acknowledging successes. We will anchor changes in process through positive staff reinforcement. Thank you guys for taking the time to check out my poster. This implementation process was just began December 1st, 2016. So I look forward to evaluating the data come January.